I was pointed in the direction of Concord Coalition by a police officer. And when I walked through the door, I had no idea what I was walking into. I just knew it had a name and we could get your mail there, so on and so forth. But when I walked in, it was from the first moment I crossed the threshold, there was a sense of relief. Because it was more warm, more welcoming. You know, somebody greeted you when you came in the door. They gave you a tour of the place, and they made you feel at home.
Founded in 2008, the Concord Coalition to End Homelessness is a nonprofit dedicated to eliminating chronic homelessness, supporting and quickly rehousing people who have recently become homeless, and building a system that effectively responds to the diverse needs of people experiencing homelessness. We believe that every person has value and deserves a home regardless of their circumstances, that ending homelessness is possible, and that maintaining a safety net benefits the entire community. CCEH operates a resource center Monday through Friday where clients can have their basic needs met by taking showers, doing their laundry, getting their mail, and engaging in case management services focused on securing and maintaining permanent supportive housing. Many clients also live with mental health issues, substance use disorders, or other disabilities, which make securing and maintaining housing difficult. To help address the complex needs of clients, the Resource Center also serves as a hub for other agencies to engage with clients and provide services such as physical and behavioral health care.
Well, so a lot of the stigma is people that are homeless are like, clearly they've done something wrong with their life. Be it they're into substance abuse or of some variety or another, and be it drugs, alcohol, or what have you. In some case, it's all they're yelling, so there must be a mental malfunction going on. So all of these stigmas are propagated by the notion that the homeless community as a whole is put in a box. And that box is given a label that these people have done something wrong to warrant where they're at, because we have a hard time with the notion that circumstances just didn't go well for somebody. The person living out of a car may very well have a job, but just can't afford the apartment that he was in, or they were in. So really that's it. The list can go on, but it's just those are the main motivators. The story can vary from individual to individual.
Outreach in Concord has taken a much more focused direction in the past year and a half. We've really shifted our priorities from purely delivering services and goods to folks in camps to also making sure that when we are going out into encampments that we have well-rounded services provided. So we have different providers from veteran services, the community action team, and then we also have youth services available. Occasionally we'll have people from Riverbend or the Harm Reduction Coalition. So we've really taken the time to make sure that we're bringing in as many different entities in Concord as possible to provide the best care out in the field. And in more recent months, that's also included medical staff from Concord Hospital checking in with people out in the field. If they have any kind of medical concerns, they can be checked out and told whether or not they need to actually go to urgent care or be provided the supplies to take care of it out in their own encampments. The other half of my job is data and data entry and enrolling people in the homeless management information system, or coordinated entry is a subset of that. Coordinated entry is a pathway into housing opportunities that are specifically created for people experiencing homelessness, much like our Housing First program in Concord. So people are pulled into our Housing First program here through the coordinated entry system. And the intake is quite long. It's got a very long assessment and asks some very invasive questions, which is why it's so important for us when we are initially starting to build rapport with people that we're doing it in a genuine way, that people feel safe to talk to us about things that are barriers to housing, such as criminal record, if they're currently experiencing a substance use disorder or a mental health disorder. These are all things that people inherently believe disqualifies them from housing and has probably in the past impacted their ability to maintain housing, if not been the reason that they were evicted in the first place. The coordinated entry system gives people a pathway to housing that doesn't preclude them because of those things. So they're attached to programs like Housing First because they're provided case management that is intended to help them maintain their housing so that they can become stable enough to overcome or to manage the things like the substance use disorder or the mental health disorder. Being able to engage with people consistently, have a team that's educated in the services that are available in Concord and educated in the ability to conduct these types of assessments and have these conversations, they can have some kind of hope. Because that's one of the biggest things that we run into is people just don't think it's possible. There's no housing, they've failed before. And outreach is an incredibly important piece of re-engaging people into that hope and belief that they are capable of maintaining housing.
We're looking at the Housing First model, which says that once you get someone into housing and have a roof over their head, then they have a chance to really address the other things in their life that maybe they haven't been able to when they're unhoused. It kind of goes back to Maslow's hierarchy of needs. If someone's need for food or shelter, for safety and security, if those needs are not met, it's kind of hard for someone to work on all these other things like their mental health, if they want to access substance use treatment, any of those things. So we work on a Housing First model in our permanent supportive housing programs. At CCEH, we have a Housing First Concord, which is a partnership with Crossroads House in Portsmouth, where they help with the rental assistance and we provide the supportive services. The participants in the Housing First Concord program are people who were experiencing long-term homelessness and who have some kind of a disability. So typically, those are the folks who have the highest needs and the most barriers to housing. My job day to day is a lot of checking in with folks that I work with. Folks in this program are ones who had the highest barriers to housing and have the highest needs typically. So it's checking in with folks to see how they're doing and really anything that falls under the very large umbrella of helping them keep their housing. That can be helping them set up doctor's appointments, taking them to those appointments, making sure that they are set up with a primary care provider. That can be helping them access groceries and things they might need within the home. It could also include budgeting, it can include tidying, anything that someone might need, especially with benefits and income. So helping them obtain food stamps, things like Medicaid, Medicare, and Social Security benefits.
Don't say, oh, that's a homeless person. Why are they homeless? Because nobody just wakes up one day and says, oh, I'm going to be homeless today. No, there's always a precipitating factor. And, if you want to understand the situation, if you want to come to grips with the situation and learn to deal with it, then just simply ask the question, why is this individual here? Because there was a reason.